Hello and welcome to another episode of Core Balance Coaching, where we get together once a week to talk about a different topic related to getting out of the back pain cycle for good. I'm Dr. Ryan Peebles, and I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. Today's topic is something I've talked about many times in the past. We've actually had similar topics in the past on these live streams, and I think it's so important that it's worth repeating over and over again. And so the topic for today is what to do if you're experiencing pain with an exercise. The situation will be, you're doing an exercise for your back. Say it's an exercise in the Core Balance Training Program or some other program, maybe it's physical therapy. It doesn't matter, whatever exercise. And the goal is to get out of pain, but you are experiencing back pain doing the actual exercise. What do you do? How do you navigate that? Those are some interesting waters to try and to navigate, because the goal is to reduce your pain, but you're doing something that's increasing your pain. And this is very common, and it's one of the most common questions we receive in the Core Balance Training Program. And so we are going to talk about this. Please let me know we are live. Please let me know if you can hear me, if everything's working all right, if you are here live, and we're going to get right into it. So the other thing I wanted to do is make an announcement. We recently released the Student Hub, which is a community for students to be able to interact and ask questions, which I'll be answering today on the stream. And part of the release of the Student Hub was to put out frequently asked question pages for all the different lessons. And so today we are actually releasing two FAQs, one for the back anchor lessons, back anchor awareness, back anchor progression, and we are also releasing an FAQ specifically for pain with an exercise. So today's topic, and that's what I'm going to be talking about. So I will show you the FAQ, and we'll be posting those after the stream today. So you can check those out. So let's get into my slides. And so this is the situation. You're doing an exercise, you're having pain, what do you do? And I wanted to start with what is the worst thing you can do? And actually also the second worst thing you could do. And the reason I want to start with this is because I believe it can be helpful to understand something that's actually very common, a very common reaction for people to do, and to just have a new perspective on why it's not good to do that. And that can help guide your understanding of why it is, why the best thing you can do is what it is. And that'll be what I talk about third here. It's a 3-step strategy that I recommend. Maybe it's not the best thing you can do, but it's what I believe is the best thing you can do after hundreds and hundreds of hours of my life dedicated to thinking about this topic. So let's get into it. So you're doing an exercise, say it's in the Core Balance Training Program. Let's just say it's the back anchor progression, which is day 3 of the program. And it's an exercise that does tend to cause some people pain, depending on their situation. And we'll talk about certain situations that it would cause pain for. But that's irrelevant right now. You're doing the exercise, it's causing you pain. The worst thing that you can do is push through the pain. The worst thing you can do is not listen to your body. Okay, so we'll talk about why, but if you don't already know, listening to your body is a major theme of the program. Everybody's situation is unique, and that means that you are in charge of certain decisions that you have to make. The truth, the fact of the matter is that you're the only one that can hear the communication feel the communication that your body is trying to send you, and there is no one else to do it. Not me, not the best doctor in the world, and so the responsibility lies on you. So the worst thing you can do is not listen to your body and just push through the pain and keep doing it and ignore these alarm systems, which is what pain is. It's an alarm system. So we got that out of the way. Don't push through it. You must listen and have. Eventually, what I'm going to be talking to you about is have a conversation with your body. So before we get to that, let's talk about the second worst thing you can do. The second worst thing you can do is say, I'm done, and stop doing the exercise. So you are listening to your body, but you're taking it to the extreme, and you're going to not do the exercise anymore and just rest, because your body, you believe your body needs more time to rest. And that is one of the worst things you can do. It would be kind of like me or somebody telling you to, talk a little quieter, and so you completely stop talking and you refuse to talk anymore because you were asked to do something a little more quietly. So when the body is communicating pain, it's not saying stop completely. It's saying maybe we should change something about the way that you're doing this, or maybe you're doing it too loud or too intense, to refer to the analogy. And so that's what we're going to talk about in this 3-step strategy. How do you know what the body is communicating to you, and how do you adapt your strategy to do the exercise? So these two things would be interpreting pain as black or white, 100% go or 0% stop. And it's like many things in life, it's not 100% or 0%. It's somewhere in the middle. It's a gray area. And this is the gray area that we're going to talk about, a strategy of asking yourself some questions, trying to interpret the pain, and letting that be your guide for how to proceed less than 100-mile-an-hour speed. So let's get right into that. So here's my 3-step approach. And like I said, this is what I believe to be the best thing that you can do. And so if you couldn't guess already, my first step is to listen to your body. And I have said many times before, I believe this is the most valuable skill you can develop to getting out of the back pain cycle, listening to your body. And it seems very simple on the surface. Well, I can feel pain. It's real easy to listen to my body. My body is screaming pain at me. So what's the big deal? We all feel pain, right? This is actually a little bit deeper than just feeling pain. Listening is different than hearing. So when you feel pain, you may be hearing your body, but when you're listening, it's an active process, and it involves you interpreting and responding in an appropriate way. And so we're going to dive deep into that, but before, I'll just keep going through this overview. So the next thing you're going to do is you're going to ask yourself what type of pain that you're feeling. You're going to ask yourself some other questions as well, which we'll get into, and we're going to kind of dive into what the different types of pain can mean. And then the third step is the thing that I probably repeat more often than anything else to students in the program when they have the question about pain during an exercise. I believe almost every time I respond, my answer involves lowering your intensity. So not stopping the exercise completely and not pushing through the pain, but finding that gray area. And there's a little bit of an art to that. So let's go through each one of these individually and I will show you, if you're here live or watching the replay, that these steps are laid out for you now in the program. We haven't actually posted it yet, but let me show you what I mean. So this is the new frequently asked questions for pain, when you're experiencing pain during an exercise. And so I tried to keep it simple and at the same time cover all the bases, which is a hard thing to do. But if you ever need to hear my best advice or read my best advice and get a reminder, this will be here for you. And we're going to be posting this both in the Student Hub and also in the lessons, along with FAQs for each lesson individually. So we'll just leave that there. And so this is what I'm going to go through right now. So I'm just going to go full screen because I don't really need any notes for this. So the first thing you can do is listen to your body. What does that actually mean? Listening to your body is an ongoing process. And so it doesn't mean that you feel something and then you react and you're done. It's a conversation that you're constantly having. And actually, one of our students in the past, I can't remember who it was, but I'm going to give her credit at some point, described it as a constant dance. And I love that. I'm taking it and using it because I love it so much. Listening to your body is a constant dance. And that's because the communication that your body sends you, if you adapt and respond to it appropriately, that communication will then change. And you then need to adapt to the new communication. And so you're constantly having to adapt, and it's not easy. That's part of the reason why it's so hard to get out of pain, is because it requires a lot of mindfulness and deliberate actions. So we will talk more about how you can engage in the process of listening to your body. But say you're doing an exercise, we're using the back anchor progression as an example, and you go to push away from your back anchor and you feel pain across your lower back, right across the entire small of your lower back, and it's concerning to you. So what you need to do is you need to slow down, maybe take a break and reset, and ask yourself some questions. So the first question I recommend that you ask is, what type of pain is this? And we're going to break it down into two types. There are many, many types of pain, but we're going to break it down into two types. The first type of pain is what I call good pain, and the second type of pain is called bad pain. And so we'll define each of these. So if you can grasp that, what I'm trying to say here is not all pain is actually a bad thing. You can actually experience pain, and it might be a sign for that you're doing the right thing. And an example would be if you are on a long road trip, maybe you've been driving in a car for many hours and it's starting to become a little uncomfortable. And so you take a break, you pull over, maybe you get gas, and you get out of your car. Those first movements that you make when you go to get out of your car, they might actually be painful, but they're not bad for you. They're actually good for you. Your body needs you to move, and it really wants you to move. But those initial first movements might be achy in your joints. The stiffness that has developed in your muscles might cause pain when you first go to move them. But as you know, as you can imagine from this example, that movement is good for you. And the pain might just be that those joints haven't moved enough recently and they haven't gotten enough fluid and lubrication, and the muscles haven't gotten enough blood flow. And so those first movements, those joints and muscles are not operating at their best right now. So those first movements are a little painful, but that movement allows and causes the fluid and the nutrition and the lubrication to get into those joints, and the blood and oxygen to get into those muscles, and it's a great thing for your body. So good pain is typically, the description of good pain is typically described as dull, maybe achy, maybe related to the feeling of stiffness, and it's usually a low level type of pain. It's not extreme, it's not intense, it's not sharp. It's the opposite of those things, dull, right? And so that is something that you might experience with an exercise like the back anchor progression, because it may have been a while since you've moved your body in that way. Maybe those joints have not done that type of movement in a long time. And so that actual range of motion is a little bit painful in the beginning because it's just not functioning optimally in those first movements. But as soon as you can kind of move through that and the pain actually decreases, and you could only notice that by listening to your body, continuing to listen to your body, then you can continue. And so, you by identifying that this pain may not actually be bad, and just continuing to experiment, and notice I don't say push through it, but you continue to feel the pain, and sometimes you are moving through the pain, but you're not pushing harder. You're actually maybe even slowing down, but continuing to move through it. Because you've interpreted that it's not a bad type of pain, your body can communicate something different to you, which is, oh, now this is starting to feel good, and you can actually continue to do more. So that is in contrast to a possible response of listening to your body too much and doing what I said was the second worst thing you can do is, I feel pain, I'm going to stop and I'm going to rest, which is, as we've already established, not good for back pain. Rest can be necessary for a day or two, but if you go beyond 72 hours of rest, you're going to be doing yourself more harm than good. And so you have lost the opportunity to actually feel better by resorting to that black or white attitude where I'm just going to go hard or I'm going to stop. So, and that brings up another point. It's actually possible that when you're doing exercises and after you've done them, your body communicates good feelings to you too. So pain is communication, but pain is not the only thing that your body communicates to you. Your body can communicate good feelings, what we call relief or relaxation, as well. And so another example of listening to your body, this first step, right here. This first step approach to dealing with pain. Another example of that is to, when you feel those good feelings after you've done something that your body likes, is to do more of it. That response, that adaptation to your behavior of doing more because your body said to you, this is good, through the feelings of relief, is an example of actively listening to your body. And it's one of the best things you can do. So typically pain means slow down, yellow light, maybe even red light sometimes. And typically good feelings means do more, maybe increase the frequency, the amount, possibly the intensity of the exercise. And so those are the examples of listening to your body. And that does involve asking yourself some questions. And so let's say that the pain is now instead of good pain, you're doing the back anchor progression, and you experience what I call bad pain. And bad pain would be the opposite of good pain. It's typically sharp. It's typically, it can be intense. So it doesn't have to be sharp, but if it's intense or extreme or, beyond your threshold of tolerance, there's no fine line to determine what is too intense or what is low intensity enough that it means good pain. So there's no clear definition. So what I recommend you use to determine that is your intuition. So you're feeling your body, you're doing the exercise, you feel some pain, and you intuitively feel like, that doesn't really seem like it's very good pain to me. I don't think that my body likes that. So I'm going to interpret that as bad pain just because intuitively I feel that way. Or the opposite would be, well, I feel some pain, but it doesn't really seem like it's that bad of a pain. It's discomfort. And let's continue to move through this. We'll do a very low intensity and just experiment and see what happens. And so that would be the intuition telling you, it may not be that bad. And we're going to continue to listen to our body and continue to have this conversation, but we've adapted our approach to how we're doing the exercise. So back to the example, we're going back to it being bad pain. It's either intense or sharp, or nerve pain is typically not a good thing. So if you're getting electrical sensations, pins and needles, tingling, potentially burning or cold or spasming, cramping in the muscles, and you can feel that it's electrical, it's a referral pattern from the nerves, that's typically not a good thing. And then the other thing is just intuitively you feel like this is not helping. That's the number one, I think it's your best tool to interpret the type of pain is just your intuition. And so what do we do at this point? So if we decide that it's bad pain, the next thing is to ask some more questions. I would recommend, if it's very bad pain or very extreme or intense, your body may not be ready for the exercise at this time. And so I would recommend taking a break and reflecting on some things. First of all, there's really three possibilities. One, it's possible that your form or your technique doing the exercise is causing the pain, and you could change something about your technique or your form, and it may feel better or be more appropriate for your body. Another option is that the actual exercise itself is not good for your body, and if assuming we're doing things that are intended to be good for your body, it doesn't mean that the exercise is inherently bad. It means that for your body, whatever the causes of your condition, your problem have been recently, that exercise is too similar to those causes. So for example, with the back anchor progression, it does cause a little bit of rounding or flattening of the lumbar spine. And if the things that have been causing you back pain recently involve excessive rounding of the lumbar spine, maybe it's the way that you sit on the couch, in a slumped posture, or maybe you've been doing too many repetitive movements, like, maybe lifting heavy objects. Maybe you moved, from, one house to another and you were lifting heavy objects. It could be anything. It could be your posture. It could be your lifestyle. It could be exercises you're doing. Those have been causing you pain, and the exercise that you're doing is too similar to those causes. And so it may be that you need to adjust something about your lifestyle or take a break for a while to allow a little bit of healing to take place. And if it were like your sitting posture, you would want to adjust that and not sit in a slumped posture because that exercise has told you a little bit about what the cause is. Exercises can be used as diagnostic tools. And so that's another option. So one is your approach or technique. Two is the actual exercise is it's exacerbating your pre-existing irritation. And then the third option is that you're just your technique is right, your form is good, but you're doing it too intensely. You're pushing too hard, too much effort, or you're moving with too much amplitude. The distance of your movements is too much amplitude. And so it's just about toning it down a little bit, backing off a little bit. And so these are the questions that you want to ask is, when we're going back to this slide here, when we're asking ourselves some questions, you can ask how, you took a break from doing the back anchor and you ask, how intense was I going when I did that? Was I going at 50%? If so, there's a lot of room to lower your intensity. You could try lowering your intensity down to 5%, 1/10 of what you were doing before, and see if that causes the pain. Or how far was I moving? What was my amplitude of movement? And maybe you can lower the amount that you're moving your limbs, or the amount that you're pushing away from your back anchor. And then the third question would just be kind of a general question, like what else can I learn from that experience that I just had, where I was doing an exercise and I caused myself some pain, I caused my back to hurt. Maybe it exacerbated something that I'm familiar with, a pain that I know, and it made it worse. Or maybe it's a new type of pain. Just what can I learn from this, and just reflect. So that is part of listening to your body, is the reflection after you've done the thing. And then step 3 is after you've taken an appropriate amount of rest. Considering that this is bad pain, and maybe it's the rest of the day. You took the rest of the day off. I'm going to try again tomorrow. You're going to go back and you're going to try again. And maybe it's 1 day off, or maybe you took 2 days off. But I don't recommend taking much more than 3 days off, because you're not going to be doing yourself any good. You're going to go back and do the exercise again at a lower intensity, and you're going to also, if you've decided that potentially some of the questions you asked before gave you information and knowledge, maybe your form or your technique could be changed. Maybe something about your lifestyle, the way you're sitting, or the way that the recent activities you've been doing in your life are irritating you, and you can modify that. You make those changes as well. But either way, no matter what you come up with, going back to full screen, because this is very important, no matter what you come up with about answering the answers to your questions, when you go back to do that exercise again, you're going to do it at a lower intensity. You're not going to quit completely. You're not going to push through the pain. You're going to live in that gray area, that area of percentages. And if you were going at 50% effort last time, you're going to lower that down. Try somewhere between 1 and 10% intensity, and see what that feels like. And you ideally want to take that intensity or that amplitude of movement up to right before that pain would occur. Now, this is the strategy that I recommend. Right before that threshold of pain, where you're going to trigger that pain, and you can feel it. If you're really tuning into your body and going at a very low intensity, you can feel right before, and you're going to stop there. That's your edge of tolerance. And you're going to stop there, and you're going to work in that range from 0 to whatever percent of movement or intensity, and that's your range of tolerance. And work right up to your edge, and the goal over time, over a period of days and weeks and months, is to push that edge further. Because by working right up to that edge of tolerance, that's how you push your tolerance. And so next time when you go back to do it, the next day, you might have 1% more tolerance, and then you're going to go right up to that edge again. and so on. And if you repeat that process and you make only 1% progress per day, in 100 days, you've made 100% progress. And so it's extremely effective in a very short amount of time. To me, anyway. I know that there are a lot of people out there that want to get out of chronic back pain in a matter of days or weeks. Or even, some people think that it's possible to get out of pain overnight. And I know that no core balance training students believe that, but I think there are people out there that do believe that. And what I firmly believe is that this is a much longer process. And so if you can take that long-term outlook and adjust your approach to be to match that perspective. Okay, this is a long-term game. We're playing a long game here. That you can really celebrate even small amounts of progress that you make each day, because on a long enough time span, they are significant amounts of progress. So that's the strategy. Those are the 3 steps, and hopefully that makes sense to someone. And this is the strategy right here. Okay. So let me take a look at the chat. I know there are some questions. Okay. So Ozty, I think you're saying Elaine is the person who used the term constant dance, and that makes sense to me. That does ring a bell. So thank you so I can give credit. And it looks like Elaine is here. I see a post from Elaine right now. So thank you, Elaine, for just bringing that term constant dance into the conversation of what it means to listen to your body, because I think it's just a beautiful explanation, and I hope you don't mind if I start using it. And yes, I do learn things from students all the time, so thank you. Let's get into some of these. I guess this is just a share from Brian. When I started doing the bridge, it was incredibly painful, so I went back to the leg lifts and toe taps and really focused on doing those. After about a week, was able to bridge pain-free. Thank you for sharing, Brian. Yeah, just a great example of toning it down, right? That is exactly what I recommend. It doesn't mean stop. Imagine if you had stopped, Brian, and you said, I can't do the bridge because it causes me pain. This is what a lot of people do. Oh gosh, it hurts me when I see people do this and they communicate this. Not necessarily in core balance training, but just out there in the world. I tried the bridge, but it hurt. I can't do it. No. Let's make some adjustments. Let's ask some questions, and let's not do 100% or 0%. Let's try something in the middle. And that is, if you can learn to get joy and fulfillment out of that process, I really do believe that is an example of someone who has already met their goal. Because there is no end. There is no destination where you're going to get to a point where you're 100% pain-free forever for the rest of your life. You're always going to have to deal with your body, and so you should always listen to your body. And the ability to enjoy the process of listening to your body and answering those questions, first asking them and then answering them, that's how you win right there. Let's go to the next one from Neighborhood Gripes. That's a great name. Doing the bridge because of my scoliosis imbalances and my left QL instead of my left QL kicks in instead of my glutes. It spasms my left rib cage and my left pelvis to touch, causing extreme pain for many days. Okay, so this is an example of bad pain. Maybe your name is Nancy, Necklace Nancy. So Nancy, this sounds like you're experiencing bad pain. So I hope you were listening during the period where you ask questions. This is going to be a very important step for you. Let me go back to the slides here. Right here. These questions are very important for you. What can you change? What could it be about that's exacerbating pain or causing pain in your body? And the answers to those questions will give you guidance they are your guidance. And they will allow you to, when you attempt this again, to have more knowledge and be more educated about your body from that previous experience in your next attempt. And of course, you're going to want to try it at a lower intensity. It's the number one thing that I believe students struggle with, is the goal is to get better, right? The goal is to experience benefits, and we tend to associate working harder with getting more benefits, which is true in a lot of areas of life, but not this area. So sometimes you have to work less hard, still do the work, but do less, mindfully, and not mindlessly, but mindfully do less. And you might discover that this is the area where breakthroughs happen. And I can say from experience that this is probably the most common area where breakthroughs happen for students, is when they finally surrender to the concept of doing something with less intensity, that they might get more benefit from that. We're going to move on. Toro, hi, this is great and everything makes complete sense. I do have a question. My issue is scoliosis and bulge discs towards one side. Will this program allow me to work on lateral unbalance? That's a great question, Toro. So it's a fantastic question. So yes, we will address side-to-side imbalances in the program, and that is something that strategically we have to do after we develop what's called sagittal stability, front to back stability. So if you look at, if you watch the masterclass or look at any of the images, it's always of somebody turned sideways. And I am illustrating imbalances in the human body from front to back. So that's called sagittal plane imbalances. And before we can address side-to-side imbalances, we do have to get that stability in the front to back, or what can happen is a twisting can happen. If you don't have that stability between your abdominals and your back muscles and your glutes and your hip flexors, and you try to fix something like this, there typically ends up being a twisting effect. And so by getting that stability in this direction, we can then go like this and fix the side-to-side imbalances. So all that to say that I believe we start addressing side-to-side somewhere in phase 2, and I'm not sure exactly which module, but you can start addressing them as early as module 3, because we do the front anchors challenge, or what is commonly called bird dog, and that you're doing reciprocal movements, so you can start working more on the weaker side. That's the strategy for side-to-side imbalances, is you just want to spend more time on the side that is more difficult to maintain good form or more difficult to maintain endurance. It's not necessarily always a strength issue. It's more often about endurance and good form, staying connected, and make sure you spend more time on that side, the more challenging side. And you can do that in module 4. And yeah, from then on, you can start doing that, because we start doing reciprocal motions, and then we do directly address side-to-side imbalances later in the program, and heavily in phase 3, which is modules 8, 9, 10, and 11. That's basically the main focus of the end of the program, is getting the side-to-side stability and balance. So great question. Next one from Elaine. Hello from Pennsylvania. Great info. Thank you. I think I overdid an exercise for my low back. Sustained hold bird dog. Felt difficult during, but no pain. Felt my usual yucky discomfort pain 5 hours later. That is actually something I didn't mention in this in my little presentation earlier that I should have. So thank you for bringing that up, Elaine. So pain, listening to your body, and the pain that comes from exercise doesn't always happen at the exact time that you're doing the exercise. Sometimes it comes later, and there is a delayed effect in the body's reaction sometimes. So when you are part of the responsibility of listening to your body is feeling what happens later and then reflecting back. And I believe that's the hardest part about listening to your body, is the reflecting back, because you could be, as you said, Elaine, 5 hours later, after having done something, and it doesn't have to be exercise, it could be anything, and feeling pain in your body and trying to associate that pain with in the moment. But if you hadn't done the work to reflect back and go, what did I do earlier today that could be causing this? You may be missing out on a great source of information that you could use for as a guideline for how to use your body in the future. So the reflecting back is a huge part of listening to your body, and I'm glad that you did that, Elaine. So thank you for bringing that up. And so you're going to want to follow the same approach that we talked about, knowing that something about your approach caused you delayed pain. And I've talked about this multiple times before. The body does send signals later on, and there could be a whole stream about why that is, but that is something that does happen. We got a message from Tim. I've had low back pain as well as plethora of issues with my right leg and feet. Can they be connected to low back? Does your course address issues with legs and feet as well as core and low back? Absolutely, yeah. Tim, I've had personal problems with both my feet and one of my knees, both my SI joints, low back, shoulder, but I'll associate that more with baseball. My neck, TMJ. And what I'm trying to say here is low back pain is not a lower back problem. It's a whole body problem. And the muscle imbalances that are underlying chronic lower back pain do have an impact on the whole body. It's a whole body problem, and we take a whole body approach. And so the program, while it's focused on lower back pain, we are reversing the predictable pattern of muscle imbalances that causes many other things. There's a massive list of things, and I don't really portray it publicly or say it very often because it would make me sound crazy to say that core balance training helps the entire body. People just wouldn't believe it, but it's actually a little bit of the truth. We've had many students who've gone through the program and said, yeah, my lower back is better, but my knees are better too, and my hips are better, and my neck is better, and it's not a neck program, right? So I encourage you to stick with it, and there are a lot of more things that you can do with your feet, Tim. So in that, with that, footwear is really important, and I would like to recommend you watch the stream I did on footwear, the best footwear strategy. It's geared towards lower back pain, but we take an approach where we are using a strategy that's not gonna have a negative effect, because footwear is a very sensitive thing. Your feet are very sensitive to what you put on them, and so yeah, I would just recommend that stream. You can find that on the channel. So the question is, can they be connected? Absolutely yes. And does your course address these issues? Not directly, but yes, we address the same underlying cause that can lead to those issues. And there's a lot more that can go into feet as well. I think if I had a second specialty, if I said I don't want to do lower back pain anymore, I'm going to specialize in something else, it would be feet. It was very interesting to me, and I have a lot of personal experience with it, as I do with back pain. So let's go on to, I guess we're going to go into the next segment of the stream that we do every week, which is the live Q&A portion. So let me go ahead and shift gears here. I think that we do have a featured student this week. So so Jennifer, Congratulations, you're the featured student this week. I don't know if you're here live, but it sounds like you completed the program and you wrote us an email. So you say, I've tried a few different programs and I've not really had great benefits. I suffered low back pain for quite a few years and have had a spinal fusion, L5S1. I was experiencing a flare-up in my low back and my husband had me listen to a clip of this program. I thought, why not? This program was different for me. Not only did the exercises help, but I believe that if the other programs also encouraged my mental ability to be positive hand in hand with a program, my results would have been better. This program has done that for me, and I believe that's why I've seen more and lasting results. I struggle days with pain, but am able to reset my mind and get back into it. The emails have been a blessing for me. I run with 4 younger children and find my schedule most times pretty crazy. I appreciate what I've been taught and fully carry it with me daily. Thank you. Thank you, Jennifer, and I'm proud of you for completing the program. I think it's amazing when somebody completes this program because it is not easy and it takes a lot of commitment. So with your 4 young children and your hectic schedule, I am even more impressed that you can commit to something like this. And I just want to give all the credit to you because you're the one that did the work, you took the responsibility, and I hope you continue to implement it because it doesn't stop here, right? You're going to continue living in your body and you can continue to integrate the concepts that you learn in the program. And by the way, you can continue to get better at them by applying them to your daily life and improve. And the improvement can really, I believe most of the improvement happens after people complete the program, if you stick with it and keep integrating what you've learned. So thank you, Jennifer. Let's go to, yes, we have a Student Hub Student of the Week. Message from my sister, copy and paste the link into your browser. Oh, okay. I think that's to somebody else. Student of the Week this week is Diane Bedard, who has been, we are giving you an extra month access to the program because you have been an incredible help in the Student Hub, participating, interacting with other students, and just welcoming people into the Student Hub. We see you, we appreciate you, and so we want to each week award a student with by adding a month to their membership as a thank you for participating. We do want to encourage interaction in there and kind of help form a little community for people to go on this journey together. So thank you for contributing with that, Diane, and we appreciate you very much. So we're going to be adding a month to your membership. You have to do nothing, but keep doing what you're doing. We are very grateful. So I think this brings me to the questions. So I think we have 10 questions for today. Yeah. So I'm going to kind of try and move through these and let's start with this one. So this is from Jeannie in the Module 1 assessment. So, the last day of the free trial, day 7. She says, I just completed the trial week and it seemed to be going well, except that I'm now suddenly getting a recurrence of neck and shoulder pain that I have suffered with for the last several months. I have a bulging extruded disc at the C5, C6 vertebrae. Okay. So it seems like this has gotten exacerbated. I fear I've re-injured it, which is very scary to me. I was in intense pain for 2 months during September and October 22. The pain finally subsided enough so that I can continue doing normal non-strenuous activities. I've been trying to be very careful in what I do and have been doing physical therapy and massage appointments, which was going well. So I'm not sure what brought on this relapse of pain in the neck and shoulder. The pain seemed to start after I started the bridge activity. Okay, thank you for that information. That's the kind of information that you will benefit from, asking yourself these questions, and getting an answer like that can help give us guidance. So what would your suggestion be? I'm in a lot of pain in my left shoulder that radiates from the bulging disc in my neck. Okay. All right. So definitely, Jeannie, if you haven't watched this stream from the beginning, that's going to be something I strongly recommend, because It's the approach that I recommend for experiencing pain like this. It's a very specific approach that I lay out in the topic of today's stream. So I do strongly recommend that you watch it from the beginning. And in addition to that approach, I'm going to suggest that because of your history with your neck, and that it seems to cause you intense pain, that you're going to have to take this really slowly. And the one thing about the bridge, if there was one thing that was not perfect about the bridge, is that it can put some pressure on your neck. I call it the perfect bridge because it's perfect in so many other ways, and there's not another exercise on the planet that has the beneficial effects that it can have on the lower back. But there's that one thing where when you're up in the full bridge, it is putting some pressure on your neck, because that's where your contact with the floor is. So there's a modification you can try where you are elevated on something. So later in the program we do the elevated bridge up on a foam roll, and that gets the neck in more alignment with the rest of the spine. Or you can just do the bridge on an elevated surface, like on the top, if you have a staircase, the top of your staircase, where your feet are on like the second stair down and your body is on the flat, and the top of the staircase essentially. And so that would allow your neck to be more in alignment. Or you can get creative and find some other platform or something to help elevate you up and just have more alignment in your cervical spine with the rest of your spine while doing the bridge. And that might be the trick for you, to not exacerbate that bulge in the disc and allow you to do it. But in addition to that modification, I would recommend the strategy that's laid out in this stream. And if you don't have a lot of time to watch it, because I did kind of drag on, I kind of went on for, a half an hour, you can always turn up the playback rate of a YouTube video. So by hitting the settings, and you can speed up, watch it at 1.5 speed. You can't do that on these live streams because I'm live, but if you're watching the replay, you can do that and really try to grasp the strategy that I lay out, and I would want you to apply that. But the one thing you say, you mentioned fear, and I want to encourage you to not let that fear cause you to stop or to quit, that you let that fear guide you as you move forward. But don't give up, never give up, and just each time you have an experience with your body, learn from it. And the next time you can do that thing, or the modified version of that thing, you will have more information. You will have more knowledge, and you will be a more experienced person doing the thing that is supposed to help you. Often it means turning down the intensity. Maybe you don't come up as high on the bridge, but it also could mean doing, modifying your technique, your form, your approach, which is what I talk about in this stream. So. Diane is here live. All right. I'm glad both weeks we've given away the Student of the Week award. The student was here live. So that says a lot about the students who are participating in the hub. They are also showing up live. Diane, you said it's my birthday next month too. Happy birthday. And we are just so happy to have you in the program, Diane. So thank you. All right. We're moving on. So Christine is... posted in the Student Hub about breathing. She says, was wondering about how sometimes my abs constrict when my back is constricting, and that feels like it's pushing down on my pelvic floor / bladder. Not a great feeling. I have to breathe to relax my gut to stop the pressure. Okay. Are these the weak inner muscles being pushed down by the outer ones? Your approach makes so much sense, and I wonder if that is what's happening. I don't think that that's the case, Christine. I'm going to read your message one more time just to make sure I gather my thoughts here. So abs constrict, so that's something you're observing. When your back is constricting and it feels like it's pushing down on my pelvic floor bladder. Not a great feeling. Okay. Nothing's popping out at me, but what I don't think is happening is the weak inner muscles are being pushed down by the outer ones. It seems to me like you have you hold tension in your abdominal muscles as well as your lower back muscles, Christine. So that is something that occurs to some people. It's not very common. It's not like the predictable pattern. Most people hold their tension in their lower back muscles, neck muscles, hip flexors sometimes, like in my case. But some people also hold tension in their abdominal muscles. Yes, I do remember I read this earlier in the week, and my initial thought was it might not be your abdominal muscles at all. So that's what I said before is possible. But one other possibility, which wouldn't be your abdominals, it would be your pelvic floor muscles, which is actually quite a common area, especially in women, to hold tension. And so, Christine, in this case, which I think is more likely, if you hold tension in your pelvic floor muscles, the muscle group of your pelvic floor, it can cause problems, and it can cause symptoms like something like similar to what you describe. And this is one of the areas of physical therapy that I highly respect, and I have no problem referring out to, which is a pelvic health physical therapist. And what they can do is they can help figure out if you have too much tension. Your pelvic floor muscles are what's called hypertonic, and it's way more common than we think, especially in women, and it can cause problems. And if so, you can do something about it. And it's a very effective form of physical therapy. It's a little bit personal, it can be invasive, not in a painful or like surgical type way, but it's hands-on, and sometimes that's what's needed to get a solution. And if this is something that's been going on with you for a while or causing you problems, I do recommend searching your local area, wherever you live, pelvic health or pelvic floor physical therapist. You can try searching both and going in and seeing one, and you might make some discoveries. So that's my recommendation to you, Christine. Not very common that I refer out like that, but I do believe in this very much. So we're going to move on to the next one. Robin, Module 5. She says in the Student Hub, "Hi, I'm on the 5th module of this program and seeing fantastic progress. I've become much more aware of how imbalanced my body has been, and the anchor triad and breathing has significantly reduced my lower back and hip pain. Diagnosed herniated disc L5-S1. Okay. I just watched the live video on pregnancy and lower back pain. I'm a woman. I'm not pregnant, but in this awareness journey, I do notice that my pain increases significantly in the days leading up to my period without noticeable changes to my routine. Are there hormonal changes during this time that could be affecting increasing my pain?" Robin. That is a fantastic question, Robin. And I wish I had done some research before, but I did not get to that, and so I can't sound extremely knowledgeable by telling you which hormones are potentially causing this, but I can say with a resounding yes that the hormonal changes that occur in your monthly cycle can lead to lower back pain, and it's actually, I believe, quite common. So in this case where it's, it seems, maybe feels like it's a little out of your control, there's not a whole lot you can do to control those hormones. What you can do is be aware and that it's coming, prepare for it, and know that you're going to need to do some things during that time, or modify some things about your lifestyle or your activities during that period of time, where and just have that awareness that it's coming, so it doesn't surprise you or throw a huge curveball in your plans. Find something that is feels good or helpful for you during that time. Maybe it's just going for a long walk each day, and maybe that can kind of feel good and help loosen things up for you. And so you can kind of add that into your routine. So that's my recommendation, because as a male, I do not have personal experience with this, and I can't really speak to it from my personal perspective, which I do for all the other things usually that I talk about, but this is just one thing I can't possibly relate to. So hopefully that helps, Robin, and just knowing that it's okay, it's common, and I've heard about this many times. So kind of planning it into your schedule, and maybe you can do some things in preparation for it that will help significantly reduce it. I know that some women use heat, and heat itself can be extremely helpful and relieving. So a heating pad, or just any form of heat therapy on your lower back or your lower abdomen can offer relief and relaxation to that. I think it's typically tension in your lower back muscles, or your in your hips and pelvis that could be leading to that. So hopefully that helps. We've got one from Paul coming in about the perfect bridge. He posts, during the perfect bridge, do my abs stay tight like I'm going to get punched in the stomach, or do I squeeze my abs like I'm trying to stop going to the bathroom? Okay. Or suck in my stomach so my stomach walls touch each other. All right, Paul, I'm glad you asked. These are the questions that I was asking in my back pain journey. Was like, what is it? How do you contract your abs? What does it mean? What does it actually mean to like engage my core? How do I do that? There's like 15 different ways I could do that. So to your third question, the answer is no. You're not going to suck in your stomach. It's called abdominal hollowing. That has been proven time and time again through evidence-based research, randomized controlled trials, that it reduces the stability in the spine. They do teach this in certain disciplines, and I don't teach it in this discipline. So I don't recommend sucking in your stomach. That is not the way to increase the stability in your spine. So we'll cross that one out. Let's just go backwards. So squeeze my abs like I'm trying to stop going to the bathroom. So that, if you're trying to stop yourself from going to the bathroom, typically that's not your abdominals. Typically that is your pelvic floor. And so there is something to be said about engaging the pelvic floor as part of your deep core. They are your deep core muscles, but they're only one piece of the puzzle, and it's not the whole picture. If you're trying to stop yourself from going to the bathroom, that is something that can be worked in to abdominal engagement, but it's not the primary thing that we're going to focus on today. Let's just call it like it's like a cherry on top of the actual dessert, and the dessert is what we're going to talk about. And if you can start adding in your pelvic floor to core engagement, then it can help improve that. So let's do the first one. Abs stay tight like I'm going to get punched in the stomach. So that would be abdominal bracing, which in the research has shown to provide more stability for the spine. And so it's a yes to that one. However, there's a little bit of a caveat. If you're going to get punched in the stomach, you're going to brace or tighten your abs 100% or 110%, right? To protect yourself. And that's not what we do or teach in the program, because what we are trying to train for is life, everyday life, going through your day, doing normal daily activities, because that's what we have to do the vast majority of the time, is not 100% intense activities, but maybe like 10% activities, like walking or doing yard work or the dishes or whatever. So it's not going to be like you're getting punched in the stomach, but it is a similar brace. And if you're wondering how to do that brace, well, you don't actually have to know how. All you have to do is go through module 1 again and do the back anchor connection, where you bring your rib cage down, connect the bottom of your rib cage and the back to the floor, and gently push away from it. That act of pushing away brings on the muscles in a healthy, natural way, the way that we developed as infants. And so that is the way that you can engage your core without having to decide, like, which muscles do I do and how do I do it? All you have to do is connect your back anchor, and all the right muscles will engage automatically, and they will figure out the how and the which and the names of the muscles. That doesn't even matter, because an infant and a baby learned a healthy way to engage their core naturally without learning any of that stuff. And so you can too, by modeling after that. And that's what we do in the program. So back anchor connection, back anchor awareness and progression, that will help train you how to do that engagement. And then when you come up in the bridge, you're trying to we remove the floor, but you're trying to use your familiarity with that engagement and continue that up in the bridge, even as your back anchor comes up off the floor. And the percentage of engagement is relative to the activity that you're doing. So hopefully that helps. But yeah, and then there is another way. You mentioned going to the bathroom. So there's another way called bearing down, which is like not to stop yourself from going to the bathroom, but the opposite. And we don't do that either. So we don't do bearing down. I just want to put that out there for anyone else that's wondering. That's not the way that we engage the core either. Let's see. I'm going to just check the chat real quick. I think we're through half of our questions. We're through 5 of the questions. So I'm going to take a mid-question break and take a look at the chat. Looks like there's been one post from Brian. To the woman who had the neck injury, I had sequestered herniation on C3 through C7. My advice is to use this program to keep your core strong while that heals. I didn't and haven't been paying for it for years. That is fantastic advice, Brian. I wish I had given that advice, because I forgot to mention that actually having a stronger core and a stronger foundation does help the neck, simply because it can allow the tension up here to relax. If we're more centered down in our core, and this is our foundation, it does allow the rest of the body to let go and just operate in a more relaxed, peaceful state. And it's like sometimes I try to avoid saying that the core and the deep core is a cure-all, like a panacea, but I really kind of believe it helps everything. And so I appreciate you sharing that as somebody who can relate to her, and I second what you say. The core can actually help by allowing the tension that we hold up high to feel like safe to let go, because there's stability underneath it, supporting the rest of the body. Okay, so we're going to go into our next question, because that was the last in the chat. All right. This is from Doug. Just checking in, Module 2. There are some extra lessons I need to go back and mop up, but looking forward to doing so. As I move forward, I think my biggest challenge is in really knowing that it's the internal abdominals doing the work. Physical cues like getting fat and feeling firmness along the ab sides help a lot. Other suggestions would be appreciated to keep me honest. I like that. I can do the bridge fully hands-free and even use my hands to massage tight hip flexors and thighs. I do that as well. I don't know if I do that in the lesson, Doug, but that's brilliant. I also use my hands to massage my hip flexors when I'm in the bridge, but I don't think I teach that in the lesson because I don't want to distract people away from what is the true priority, which is core connection. And adding that extra layer is a distraction, and I really don't want people doing that if they haven't mastered how to stay connected to their core and breathe, because there's a lot of layers involved just in that before adding in extra things like that. So, but if you can maintain connection and chew gum and walk at the same time, then good on you. But I have pretty good external athletic strength. So I worry a bit about using them big movers too much over the internals. I can just really, Doug, I can tell that you grasp the whole purpose of this program. I do believe that this program is typically more difficult for highly athletic, highly fit, and strong people. And that's because of the very thing that you say, that the tendency for that type of person is to use the big, powerful mover muscles. And just being so accustomed to being athletic and being able to power through things and excelling at high effort, high force, high velocity things, it just becomes a tendency. And so the key for you is to resist that tendency to want to go hard and go full on, and turn this into if you want to put in 100% effort into this, put 99% of that effort into your mental focus and only 1% into the physical prowess that makes us feel so strong and powerful, because we are trying to tune into muscles that are a lot less, they're not visible. They don't flex. We can't see them from the outside. They don't give us any, they don't get us any modeling contracts or anything like that. This is about the muscles that get no glory. And so it makes it tough, especially for people that are used to being fit and athletic. So any tips, around what you're doing? I'd say just turn down the intensity even more than you think you want to. And if you feel like you're not doing enough, do less. That's my best tip, because that's how you're going to really access those muscles. And that's why I say over and over again that turning down the intensity can offer you more benefits than putting more effort and more intensity into the exercise of what you're doing. Okay, hopefully that helps. Let me see something in the chat. Okay. George is here live. I see your post. Toro is George, and I did answer his question. So hopefully he saw that. And it seems like he was responding to that. So, yep, I already answered that question, Asti, so thank you for letting me know. And we're going to go on back to the slides. So we got, 5 more. So here we go. Foot overpronation. I have back pain around the SI joints from lower cross syndrome due to way too much sitting. This program has really helped decrease the lower back pain. However, I still have foot overpronation that hasn't really improved. Are there other exercises that can be done to specifically address this? Overpronation, Brendan. Okay. I will say, Brendan, that I've had a lot of foot problems in the past, both feet, and they've taken me down. I've been completely bedridden by foot problems, but my feet are the opposite. I have highly supinated feet, and so personally I cannot relate to overpronation or that type of foot issue. But I'd like to ask you, because this is kind of significant. I've been taught, and a lot of people have been taught our entire lives that pronation is bad. And I've come to believe over the years that it's actually, and we're taught that high arches are good. Like I remember I used to show off, like, look how high my arches are. and we'd be able to do a footprint in like the sand or a foot or like your foot markings from when your feet are wet on the pavement, and be able to compare with your friends and be like, look how high my arches are. But I'm the one that gets the foot problems, and the people that I know in my experience, and this isn't even from PT school, this is just through experience, that have pronated feet don't seem to have the same problems. It can turn into problems. There is such thing as too much of anything, but pronation in itself can actually be a good, healthy foot if it's a healthy type of pronation, if it's a strong pronation. So that's the one thing that I just want to kind of clear up, is that I don't think pronation is a bad thing. If I hear over supination, I start being a little more concerned for the person. So what I'd like to ask you is, do you have foot pain, Brendan? And before I can give you any more advice, I'd like to know if you actually have foot pain. And if you can get back to me, just like post, respond in the Student Hub, I can maybe talk more about this next week. If you do have foot pain, then we'll talk about some strategies. But if you don't have foot pain, then I would say let's not fix something that's not broken, and we can talk about why pronation actually can be a healthy foot pattern, because you have a lot of surface contact with the ground, and that reduces the pressure points on the feet. You have more if the contact on the ground was this much, you'd have a lot of pressure on this little dot right here. But if you flatten it out and you have a lot more contact areas, the pressure is spread out over your foot, and it can be like in my case, I wish I had more pronation. And I have another physical therapist friend who's a brilliant physical therapist who has extremely pronated feet and very, very healthy feet too. And he can walk over anything because he has got so much good surface contact. And so keeping your feet strong is important. And the footwear that you put on your feet is very impactful for that. So I would recommend taking a look at the stream on footwear that I actually referred earlier in this stream. So if you go to the Core Balance Training channel, I have done an entire stream on footwear and a strategy, and I think that could be useful to you because if you're using arch supports to try and counterbalance your pronation, I don't think that's a helpful strategy. And I think that there's a different strategy that you can take to improve the health of your feet. So that's where I'm going to leave it, but go ahead and respond and let me know, do you have foot pain, Brendan? All right. I think there was a post in the chat. Hello, Marina, my wife. Good to see you. You must be on lunch break. Marina is a teacher, so hi. So let's go to the next one from Joshua. And Joshua's, this is about breathing. I feel some pain on one side of my back when really breathing hard into it. I do really feel the decompression, but I think that is where the pain is coming from. Can you please explain why this might be happening? Yeah, I think that this is happening because you're breathing really hard into it. So anytime we're going to be, pushing really hard or doing really high intensity, it's usually too much, especially with breathing, which is something we do all day long. And the breath actually, if you're doing this as an exercise to get that decompression, I do talk about doing that, like high intensity, just to feel it and get that decompression. And one of the things that the breath can do, one of its magical powers, is it can highlight problem areas. It can find problem areas and find imbalances. If you have tension on one side and not the other, the breath is going to find that, and it's going to highlight that or exacerbate that, and in a good way. I believe it's in a good way, and it can send some expansion into tight muscles, and it might be painful, but that's what they need. And so in this case, Joshua, I think that it's just because you're breathing really hard, as you say, and that's found an area in your back, and it's not because of the breathing, it's a pre-existing thing, and the breath has just found it. But when you do the breathing and apply it to your normal daily life, I do recommend you turn down the intensity and practice it in a way where you can do it all day long so that it's sustainable. So, the same intention, breathing into your lower back, but at 1%, 2% effort, that's the way you're going to be able to get the benefits over a long period of time. So hopefully that helps. We're going to go on to the next one from Jorge. Oh, okay. So Jorge I thought I already answered a question about this one. No. Anyway, we'll answer Jorge's question. So lateral imbalances. Yeah, so this is what you're referring to, Osti. Okay, so this is great and everything makes complete sense. I do have a question. My issue is scoliosis and bulged discs toward one side. It's like so similar to the question from before. I'm going to find this other question. Sorry, guys. Give me a second. I don't know how, but I think I already answered this question. Yeah, I did already answer this. Okay. It was in the chat. So Toro Robbins. Okay. All right. So thank you, Osti. You're saving me from answering it twice is what you're doing. Okay. Hello. I get you. Sorry, everyone. All right. So I already answered this question from Jorge because he's here live and he asked the same question in chat. Just to clear things up. All right, so this one's from Joanne, and this is about the hip hinge. When doing the hip hinge, I feel stress in my hamstrings. I believe that I am keeping a good aligned position through my upper back and hips. Should I be bending my knee a bit? Good question. I am progressing well with other pieces of this program. Definitely have weakness in my hamstrings, Joanne. Okay, so yes, you're going to have a little bend in your knee, Joanne. So with the hip hinge, there may not be clear in the lesson, but the knees should be soft, what I call soft knees. So they're not locked, they're not 100% straight, and they're not bent. They're unlocked. And so that's what I would call soft knees. Maybe there's like a 2 to 5% bend in them, and you might be able to see that if you look closely in the lesson. If you look at the way my knees are, they're unlocked. And so that's actually the answer to your question, but I can give you a little more advice. The stress in your hamstrings with the hip hinge is not surprising because it's a heavy loaded movement for the hamstrings. And so it may mean that you are overusing them a little bit. But it's like, how do I not overuse them, right? I'll try to squeeze my glutes more. That's one strategy you can take to try and, if you help more with your glutes, it can help take some of the load off of your hamstrings. It may also just be that you need to take a day or two off from this. It may be that your hamstrings are sore from doing something else in your life. I know I did a steep hill recently, hike, and my hamstrings got a little strained from that. It wasn't usual, but a lot of the time, the hamstrings do so much for us, and every single day of our life, with every activity we do, a lot of it is a cumulative effect. There's more than one factor going into it, and so maybe just unlocking your knees for the hip hinge could be the thing, or maybe it's other things that you're doing where the hamstrings are already a little bit sore or strained from going into it. And the bridge does do, a lot of work on the hamstrings. So try to pay attention to all the factors and take a day or two. The hamstrings might need to heal because the strain is micro tears happening, which is very normal. It happens to every athlete after every game. So don't worry about it. And then when you come back to it, your approach should be modified, reduced intensity, modified technique based on the knowledge that you've gained from doing this before. So that's the entire topic of this stream. So while you're not having significant pain, the topic of the stream of listening to your body and responding appropriately is relevant to you here. So I'd recommend you check that out. And we'll move on to the last question of the day. This is, wow, we've been going for about an hour and a half, and so another hour and a half stream, and we still got people here. So, hey, thanks for being here live, everyone who is here. If you're enjoying the stream or have learned anything today, please hit that like button and support the stream so we can keep producing content like this and help the channel reach more people. Because I think there's a lot of people that could benefit from something like this. And if we can get YouTube to start sending this out to more people, I think that would be helpful. And so, yeah, help support the stream. Thank you, everyone, for being here. And this is the last question of the day. So this one is from Kathy. Posted in module 1. I just started my 7-day trial with great hope. Still working on a diagnosis for my low back pain, which has become excruciating in the last few weeks. The breath work is interesting to me, as I was taught in martial arts to work on diaphragmatic breath, letting the belly push out with the inhale. I have to focus on contracting my core with the full exhale to achieve the breath into my back, but I think I do feel the difference. Kathy. Yeah, so that's interesting. It's interesting to me still that the way that we teach breathing in this program is different than, sometimes it feels like it's almost the opposite of the way breath is taught in other disciplines. And I have written a lot about that and how they may not be exactly the opposites and may be able to work together, but certainly the goal is different, especially in yogic type breathing. The goal is to access the energy flowing through your body, your chi or your prana, and to have it flow through your body. You're using your breath to do that. In core balance training, the breath is basically a channel to help access muscles that helps support your spine and stabilize your spine. So it's a means to improve back pain specifically. And it seems to be really effective. So I would encourage you, Kathy, to feel the difference, like you said, and decide for yourself what feels better for you. And I think a lot of people who have asked this question in the past have found that this style of breathing does seem to provide relief. And I've found that after working on it for maybe, I don't know, between around 8 years, I'm going to be going on a decade soon, that I continue to get better at it. It continues to provide me even more benefits. And it's just been an amazing and fulfilling journey of improving my breathing. There was one other thing that you said, still working on a diagnosis for my low back pain, that I wanted to comment on. So I've spoken a lot about this. I've written a lot about this. The diagnosis can be important. And I know that there is a lot of desire in a person, including myself, that when we have pain, that we want to dive into what is happening, what is the injury. And so we go to the doctor, we get imaging taken, we get x-rays, MRIs, and we see the picture and we see the damage and we get given a diagnosis and we go, yes, I have my diagnosis, I figured it out. But the reality is that it doesn't genuinely help solve the problem. in many cases with chronic lower back pain, it does not give us much information that's going to change the outcomes of your back pain. And that's not my opinion. That's told in the research that's been shown extensively in the research, that getting imaging, getting an MRI does not improve the outcomes of chronic lower back pain. And what I've come to believe without that research, just on my own, is typically the problems that result from what causes lower back pain can vary quite a bit. It can cause a disc bulge or a disc herniation or stenosis, or it can cause many different things. These are the results. These are the outcomes. But the underlying cause that's upstream of all those really small injuries to the spine that are not visible to us on the outside but can only be seen by an MRI, that underlying cause is typically the same. And because there's so many other variables in a human life and body types and lifestyles and postures, that the result can vary in the way that the bulge happened, on what side of the disc, and stuff like that. But when we're talking about a solution, it's not going to change the way that we do the exercise. It's typically not going to change the exercises that we do, and the solution is still going to be the same. It's going to be building more support for your spine. And the way that we do that is by developing a stronger relationship with the muscles that are very close to the spine, the deep core muscles. And so I only am telling you this, Kathy, to encourage you to just listen to your body and keep doing what seems to be working. And if you are experiencing benefits, do more. And if not, then go back to the beginning of the stream, and we can take the approach of how can we make adjustments that will give me benefits. And the benefits are what's important. And if you can do that, then you may not ever need to get an exact diagnosis, or get it in writing from a doctor that your body is broken, or that you have a specific injury to your spine, because it may not be important, and it may actually be better for you to not have that diagnosis to focus on and have a negative effect on your psychology, because that's what tends to happen when we get imaging. And like I said, I've spoken a lot about this. There's been a whole stream on this, multiple streams, and multiple YouTube videos published, so you can check those out from the channel. And just encourage you to develop the most important skill that you can possibly have to getting out of the back pain cycle, which is to listen to your body and adapt your approach to what your body is saying. And that is a constant dance. So thank you for posting. Hopefully that helps. Post from Diane. I'd love to hear your tips on foot pain from high arches. I too have high arches and have had lots of pain in the past. Brand for great arch support. Super helpful. Olukai, Echo, Teva, Cloud X. Diane, have you seen, since you're here, I can just ask you, have you seen the live stream I did on footwear? Because I went deep into footwear. We're going to be publishing a video from that live stream pretty soon into a shorter, more digestible YouTube video. But I go pretty deep into footwear. So as my recommendations, I don't typically recommend high arch supports, but if you're used to high arch supports, then we have a strategy to reduce that support, because with high arches, you don't actually want to push them up. It would be like pushing up on the top of an archway. That's the weakest point to push up on. And you can actually take the strength out of the arch by pushing up in the middle of the arch. And so what we want to do is we want to gradually reduce that arch support over time. And you cannot do this quickly. And I talk about this in the stream, so I'm not going to go on about this right now. But yeah, and the high arch thing can cause problems, and I can talk about that in the future. I think because we've been going on too long today, that I'm gonna push that one to a future stream, because I can just, as you might realize, I can just talk forever about this stuff. But there are strategies that I have had to use on my own body, and things that I can recommend for dealing with high arches, and how, the goal is to reduce them, to lower the arch, and to kind of break down the foot in a healthy way, in a strong, healthy, functional way, so that you have more surface contact with the surface that you're walking on. So there's less pressure points causing pain. And if you have foot pain, you may need arch support to bring the ground to you, to spread out that surface area, to spread out those pressure points. But that's not a long-term solution. That is a temporary solution, like wearing a brace, so that you can get through a period of time and let pressure points heal, as you are in conjunction doing a strategy to make your foot more healthy, so it doesn't need those crutches, for lack of a better term. And then there is the possibility you can just use high arch support for the rest of your life, if that works for you. And a lot of people do that, and that's totally fine. It's just not very helpful for if you want to be able to walk barefoot, or walk around without the arch support sometimes. So yeah, I guess I did talk about it a little bit here. I didn't want to leave you hanging, but yeah, that's check out that stream. I guess I've recommended that stream 3 times today, because we have a little bit of a theme of foot issues. And anyway, I'm going to wrap things up. Thank you, everyone, for being here live or catching the replay. Please hit that like button and support the stream, so we can spread the word that there is a solution to back pain to other people on YouTube. And also share this with somebody that you care about. If you think that this message, or any of the messages that we teach, can be helpful to somebody don't be afraid to just share it with them. You can share the link, copy the link, and send it to somebody, because I do believe that the more that we can get the word out, that there is a real long-term solution to chronic lower back pain, the more people we can help. And that's what it's all about for me. So thank you all for being here. And until next time, get down on the floor and connect to your core. Take care, everyone.